Dr. Levin, if I could real quickly. Claim is made that 20,000 or so people died after receiving the vaccine. Of course, people do die. They have auto accidents, heart attacks, they suffer from disease, and terrible things happen to people. But what can you say about this claim that people have died directly from the vaccine?
The last time I heard about this, Supervisor, was probably I've heard about it a number of times, but the last time I looked into it, the number was similar. It was about 6 weeks ago. And I looked into it, went to the CDC site, and found that one person had died related to the vaccine, directly related to the vaccine. These numbers are gross exaggerations by people who I think are trying to discourage people from getting the vaccine. They're fabricated.
And one person out of how many vaccines do you guess?
Oh my gosh. How many vaccines have been were administered as of 6 weeks ago or so in the United States? Probably 300 million at that point, 400 million.
Thank you. Thank you. And it's just we have such very clear numbers and graphs and information that comes from the public health department, from our public health officer. And then at the end, we just want to make sure that people understand there's, verifiable truths out there from, as I said, reputable doctors and physicians and scientists. And we are so fortunate in the United States to have that access. And I just want to encourage people to, do what they can to protect themselves and their community. So, thank you.
Chair Parks, if I could just go into detail on that one death. It was a patient with myocarditis, but the vast majority of people who get myocarditis, who've gotten myocarditis, and again, it's rare. It's about 10 out of a million. Many of them are hospitalized. The average length of stay is less than 2 days, and virtually all of them make a full recovery.
Thank you very much. And I really appreciate getting the truth out and the facts out. Obviously, there's a group that have some conspiracies and all. We want to make sure that the public has good information. And that's really what this agenda item is all about. So thank you very much.
Thank you for that opportunity to explain.
Thank you. And I believe we do have the receive and file. Have we?